Welcome to the Australian Chiropractors Association podcast. The ACA is the peak body representing chiropractors in Australia. These podcasts explore the science, art, philosophy, and politics of chiropractic, as well as reviewing the latest research and discussing how chiropractors can strive for excellence in practice.
Welcome to the Australian Chiropractic Association podcast. I'm your podcast host, Dr Kim Lie Jom, and today we have a conversation that's going to challenge you to think bigger, guys. It's about your practice model and the collaborative opportunities right in your own community. We often talk about being primary care practitioners, about our unique understanding of the nervous system and cranial mechanisms. But what if I told you there's a chiropractor who's taken that expertise and embedded herself into a functional dentistry practice? Not as a side hustle, but as an integral part of their treatment team. I'd like to start this podcast by firstly respectfully acknowledging the traditional custodians of the land on which we record this podcast and pay our respects to their elders past and present. We recognise and honour their ongoing connection to land, waters, culture and community. We extend that respect to all Aboriginals and Torres Strait Islander people listening in today. So today I'm speaking with Dr Rebecca Bowring, an SAT and craniopath chiropractor who's done exactly what I said a few minutes ago. She's working inside a functional dentistry office, and the results she's achieving with patients are extraordinary, just to say the least. Here's what makes this conversation essential for you. I think all the listeners will get a lot out of this one. Becca's figured out the blueprint for making this kind of integration work, both clinically and professionally. So get ready, listeners and docs. I want you to think differently today, and Dr. Beck Bowring is going to do that for us today. Welcome to the show, Beck.
Hello, Kim. It's so wonderful to be here. Anytime I get to have a chat with you is good, but talking about my latest exciting adventure is really cool.
Yeah, I'm so excited for you. And when we touched on this briefly before we went to the ACA conference, and then having heard Dr. Jalal Khan speak at the ACA conference this year, it just completely opened my understanding and the possibilities of our profession collaborating. So I'm so excited about this conversation we're about to have. So let's kick it off. The journey. Okay, let's look at this. You've done something pretty unique, in my opinion. You've been able to integrate your chiropractic directly into a functional dentistry office. I said that from the outset. So tell us a little about the journey. How did this come about? How did this all evolve?
Well, believe it or not, by this young face, I've been a chiropractor for about 32 years and have always loved collaborating with other practitioners, mostly dentists, naturopaths, midwives, GPs, and exercise physiologists. I'm really good at knowing my strengths and knowing my weaknesses, and I'm really, really great at networking because I quite like a chat. So this latest gig is just a natural progression to all of this, bringing what started off as a great referral network into true real-time collaboration, being in the same room at the same time and really working together for outcomes, not just referring, but really working together.
Yeah, that's what we love to hear. This is very different. I think traditionally we have always referred to other practitioners. I think there's always that mutual respect of, you keep your space, I'll keep my space, I'll refer to you, vice versa.
Yep.
But this is very different, and I love how you've integrated into that. So tell me firstly, was this something that just sort of came organically, or did you have to work really hard in that collaboration to bring the relationship together? And what was the initial conversation? How did that come about?
Well, funnily enough, in my life, this was not where I thought I'd see myself. To be honest, my husband, Darren, who's also a chiropractor, is a much more proficient craniodental chiropractor than I am. He actually wrote the textbook, the SOT textbook on cranials.
Correct.
No, he's a bit of a legend in the field.
Yeah, it's pretty cluey, that Darren.
Yeah, I think he was surprised that I started going along here, but in our practices, he would classically see all the TMJ and the cranial cases, and my area of interest has always been kids and mums. So this was surprising at kind of where it led me from a what I do with my hands point of view, but from the relationship point of view, it was kind of where I've been aiming for all this time.
Mm.
And it was born out of my skills for communication and network building rather than my technical skills, which is something I really wanted to drill down into, particularly for the younger practitioners that sometimes you don't know what you're going to be good at
Mm.
and find your strengths that might lead you in really odd directions. So I suspect I'm the living embodiment of it's not what you know, it's who you know. Um,
Fantastic.
and that building relationships is probably the most important part of how this started.
Mm.
So, as you know, Kim, I work in three of my own offices. I've got two kids. I'm on a few professional committees and have a pretty full social calendar. So I
Mm.
certainly wasn't looking for a new gig at this point in my life. But sometimes opportunities just come up that you cannot say no to. So about 18 months ago, I had an osteopath friend of mine, Cole Clayton, who's a bit of a legend in the osteopathic world.
Mhm.
I asked him if I could come and observe in his practice that he was
Mhm.
establishing with a dentist in North Sydney because I thought, oh, that sounds pretty interesting. I'd worked with dentists for many, many years
Mm.
and found it really frustrating that I would find something and say to the patient or the parents, look, when you're at your dentist next, can you let them know this is what I found? I'd really like them to adjust your appliance and get them to give me a call. I'd write them some reports. It may have got there, it may
Yeah.
didn't get there. It's all a
Yeah.
bit of like Chinese whispers and
Yeah.
kind of hoping that things would happen in a timely manner. So this was really interesting to think, okay, we could do things on the spot, and I wouldn't have to wait for a parent to uh,
Mm.
level my recommendations. So what I did, I just went out and hung in Cole's office for an afternoon and really loved the fact that he could just pop next door and say to Jalal, can you come and adjust this appliance for me on the spot, and then
Ah.
check whether it was what was necessary or not. And
Mhm.
I had a fireware comment, oh, I'm really envious. This is really cool. And he just said, hey, do you want to join the team? And that was
Oh,
it. It was really organic,
yeah.
just born out of curiosity, I think,
Lovely.
more than they knew the sort of person I was and
Yeah.
knew I'd been doing it for a while, so I must be all right at it. It wasn't about I'd been to the right seminars. It was
Yeah.
because I wanted to know what they were doing, and that I think is kind of unusual in everyone's professions. We're also
Mm.
I do what I do, and it's the best that I don't think
Yeah.
looking far afield. But I don't think the boys really knew what they were in for when they first came onto the team. We all knew each other were great and that we loved what we did and we love kids and
Yeah.
heads and collaborating. And that's what this
Mm.
is born out of a love for collaboration more than any particular technical skills that we might have had.
Yeah, look, I love that. I love that I'm going to say foresight into how the two professions can come
Mm.
together. And genuinely, your personality is just so bubbly and easy to get along with that. I can't see why they wouldn't just take you
Me
on before you
either.
even ask the question, right?
Oh, poor Darren may disagree with you.
No, it's fantastic. And I think that that's such a wonderful thing. And we're going to talk a little bit more about this, but in terms of the business side of things, let's think of it from the practical sense for
Mm.
our listeners. Did you have to convince the guys in their office that the patients could benefit from having a chiropractor in the actual practice itself? Did you get much resistance towards that? Because obviously, I mean, they may know chiropractic, but do they know chiropractic like you and I know
Mm.
chiropractic?
Mm.
And was that the hindrance, and if there was any, or was that more of a, they showed curiosity to what you do? How did you find that?
I think it's more the latter. I think we were just a
Mm.
bunch of really curious people thinking, I wonder. I suspect when they first said, join me, it was a bit of a job interview. Come in, see if you can up anybody up and muck up our model, and then we'll run from there. So
Yeah.
practically what I brought to the team was a passion for little kids. I love 0 to 6 year olds.
Mm.
I just love them. And classically, these are a tricky age group for both cranial osteopaths and dentists
Yeah.
because they're really wiggly and they're
Yeah.
not following instructions. So the other thing that I brought to the table was that they also often present with retained primitive reflexes and really sensitive
Ah.
gag reflexes,
Hmm.
which
Hmm.
makes doing stuff in kids' mouths really challenging.
Yeah.
And who'd have thought actually from doing this work, I found I'm really good at both of those two things. It wasn't something I would have ever put myself out there. Come to me, I'm the gag lady, but that seems to be chiropractic works really well at desensitizing these sort of oral neurological winding up, I suppose they were.
Yeah.
Um, and yeah, I didn't know that we were so good at it, but we really are. I'm also,
Yeah.
as you know, pretty silly and I talk a lot, which works really well with little kids. But as an
Yeah.
added benefit, I'm really great at talking to mums, and it's what I call mumsplaining. It's
Yeah.
identifying to mums how all of our interventions. So I kind of take on a communication role as well of kind of explaining the dental and the osteopathic and the chiropractic role in
Hmm.
a way that mums don't feel overwhelmed, because oftentimes really great mums go to a lot of places getting lots of advice, and then suddenly they feel like they've taken on a new job
Yeah.
doing all the exercises and taking them to things.
Mm.
So I suspect some of my magic in the office is about taking away mum's mental loads, particularly mums. We see a lot of dads as well.
Mm.
But yeah, it's all about the mum's mental load. My biggest frustration with working in that practice, it's a kids only practice, and I just love mums. And my opinion is you can't have a healthy kid without a healthy mum. So I find it really
Yeah.
difficult limiting myself. Um,
Yeah, I couldn't agree more about the nature of being able to explain things to the mum, because
yeah.
traditionally we find that the mums in particular are the ones that make the health decisions for the family, don't we? And so I can imagine they would be armed with questions
Mm,
when it comes to their child,
mm,
as every mother should. And I
mm.
think that that ability to bridge that gap and explain to them so as to why their child needs this is really important. So I couldn't agree more about what you said there.
I often like I have a bit of a shtick, and I always tell the mums I'm a mum first and I'm a practitioner second. So
Yeah.
everything that I suggest is stuff that I, as we all do, practice on our own children,
Mm,
and made sure this was actually practical, um, outcomes based interventions. There's all
yeah.
very good. We go, oh, I'd love a straight looking spine and
Yeah.
this
Yeah.
blah 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 blah. Is that something that is going to give bang for their buck, bang for
Hmm.
their time? And explaining it from a mum's perspective of why this would be important, not just because I'm the doctor and you do what I tell you.
Yeah, yeah, yeah. I think those days are kind of gone, right? I think
Yeah,
with
yeah.
the amount of information that the average person can get
Mm,
online, I
mm,
think their natural curiosity and ability to ask questions of practitioners is so much more profound nowadays. You know,
mm.
they literally can.
Yeah.
And so it's fantastic that you've been able to do that. Now, obviously, we know that dentistry and chiropractic have traditionally operated in fairly separate
Mm,
silos,
mm,
if anything. Um, what did you notice in the beginning, the biggest cultural or, I mean, professional differences between the two? Because obviously you've worked as a chiropractor for 30 odd years, and now you're moving to a space where you're trying to not only educate the patient, but also, I'm assuming, the team as well. So
mm.
what were the biggest challenges that you found in terms of, those cultural professional differences?
Look, not much actually in
Oh,
this
great.
in this latest iteration.
Hmm.
Maybe because Jalal's got a pretty holistic philosophy to his dental work, and both
Hmm.
Cole and I are pretty cranial in our approach. So the collab worked pretty seamlessly. But in the past, I've encountered dentists that really don't get the neurological component to health,
I
or
agree.
even, funnily enough, how posture would have an effect on the cranium or the person's bite.
Mm,
Thankfully, that wasn't a problem here, um, because this is a very unique thing, and so
yeah.
I don't necessarily think that everyone's going to get as easy a run as I did. I'm completely blessed that I just landed in this position, because in our model, the body work tells the dentist whether their work is right or
Hmm.
what adjustments need to be made to their appliances to make the body work, which is
Hmm.
really
Hmm.
cool. So there is a lot of ego in the dental and the chiropractic world,
Mm,
where dentists that I've worked with in the past don't really like to be challenged and don't like to be told what to do.
yeah.
That's completely flipped on its head. Jalal has been very clever, I think, to recognize that we make him look pretty good and we
Mm,
make the results happen quicker. There's less pushback from the parents and from the kids. So
mhm.
our role, we go in there and say, yep, Jalal, you've done a good thing. They can leave now. And pretty much the kid doesn't get off the couch until I'm feeling the head, looking at the posture, doing all my neurological testing.
Yeah.
to say that that device is doing a better thing for that kid than when they walked in, which is quite unique, I think, in the field. I suspect, I hope that we are starting a trend for collaboration where that sort of behaviour is expected, that a parent
Hmm.
will say, is everyone here happy with everyone's work? Um,
Mm.
and there's no boss. It's just who is going to serve my child the best. The,
Hmm.
the way I knew that this was going to work for me, there's three mottos at the Quantum Kid. The first one is kids first, which
Hmm.
was so important to me. It was all about, is this a device that the kid's going to be able to live with? Sincerity, what you see is what you get. If we don't think it's going to work, we'll tell them. And pioneering. So I think the boys
Yeah.
would say it's pioneering in the techniques. I've been around for longer than them. I've seen a lot of the techniques that they do before. What's pioneering is the collaboration and the lack of ego and being uh, humble enough to have someone check your work in real time and
Hmm.
be prepared to make changes that are necessary
Hmm.
um, to do the best work for that kid.
Yeah,
One thing
look.
I did want to say though, the thing I did notice was a difference in our fees. So this is my
Ah,
controversial bit. I'm not going to say anything else controversial apart from um, parents were quite accustomed to having dental treatment plans in the thousands.
yeah,
And in my world, kids' schedules of care were mostly sitting around the hundreds.
yeah.
And it cemented for me how affordable and valuable chiropractic care is, and how
Mm.
often we don't realize how we make other practitioners look amazing. We
Yeah.
make their lives easier. We turn difficult cases into easy ones because we get the nervous system primed and ready to go. And
Hmm.
I think oftentimes chiropractors, we see ourselves as sometimes the little brothers and sisters of the medical world. And
Mm.
this experience to me showed that we are very affordable and very cost effective. It
Hmm.
actually makes people spend less money on the dentist, which is fine.
Mm.
Jalal's not so busy; he's not worried about that. But they do spend less money elsewhere because chiropractic is incredibly affordable. And it took working in a practice where people were happy to hand over $7,000 for a 12-month treatment plan. I'm like, holy moly,
Yeah.
what I could do with $7,000 with your family.
Yeah.
That was quite extraordinary for me and gave me a
Yeah.
lot of confidence in what I did. Funnily enough, that a financial reward would do that, and it does.
Yeah, that's such an important point. I think and certainly I can speak on behalf of all the young practitioners listening in. When we first get out, you naturally feel like you almost have to prove yourself, and in
Mm,
doing so, there are times when you do naturally undercut yourself.
mm,
It's almost like, as I've said before, it's almost sometimes a race to the bottom.
yep.
In actual fact, we need to place greater value on what it is that we do. We are significantly impactful in our communities. And I think that what you said there is just going to highlight, and I hope that our listeners, particularly younger crew, really understand the importance and the value of what they have achieved in the last 5 years and now embarking on this journey, and that they should never undersell what it is that they
Mm.
do and how important that they are to the healthcare system.
It is
So I appreciate you
difficult.
sharing that.
Yeah, I suppose we all set our own fees. Most of us work in small groups,
Yeah.
and you have to actually put a number on your worth. And that's very
Mm.
difficult to do when you've been at university. It was lovely. The boys going, "You're worth this." And I'm like, "Oh, shoot, I'm going to have to give serious value if you're going to bill me out at that." And
Yeah.
then I realized I did the same stuff. Like
Yeah.
in my little practice, there's always a
Mm.
space for looking after people who can't afford care. There's always
Absolutely.
that can happen, but it's about valuing what you do, uh,
Exactly.
which I
Yeah.
would really love young practitioners to come and see what I do and go, holy moly, that's amazing.
Yeah.
And I can do that.
Yeah.
And it might give them the confidence.
I couldn't agree more. And I think one of the things you touched on earlier is I love the way you mentioned the word there's no ego between
Mm,
practitioners and how
mm,
you guys work collaboratively together. And the
mm,
ultimate outcome is patient success, right? Patient
yep,
outcome, right?
mm,
The joy in a parent to know that a child has been able to have a breakthrough, whether it be breathing, sleeping, or TMJ issues, through the work that you guys do. I
mm,
think that's the ultimate thing. We all are striving towards better patient outcome, right?
yep,
That's just a given fact. And in this day and age, people are looking for the best outcome for their health and
yep,
particularly in their kids too. So,
mm,
yeah. So what I got out of what you said there was very much no ego,
Mm.
patient outcome,
Yep.
and also that clear explanation of their journey and their health perspective. So that's fantastic. I appreciate that enormously. I'm going to ask you in terms of maybe giving us an understanding, a bit more of a clinical aspect. Can you walk us through a specific case where there's the combined chiropractic dental
Mm.
approach that was had with a particular patient, patient X, something that you may have seen recently or previously, that neither profession could have
Mm.
achieved on their own,
Mm.
alone.
Yep.
And what was the sort of presenting problem, and
Mm.
how did you and the dental team coordinate one another to achieve that outcome?
Yeah, absolutely. I put some thought into this because it is important that we have practical explanations. So it's not like, oh, we do cool stuff and you should sort of.
Yeah.
So we had a case of an 8-year-old girl who was bedwetting. Now,
Hmm.
this is reasonably common, but not so much in girls. And the parents had heard that chiropractic care was sometimes helpful in these sort of cases and had consulted a chiropractor with no real results.
Hmm.
Although they hadn't really followed things through and had only had a few visits, so I really don't think they'd given chiropractic a go. But it was interesting that they hadn't experienced a chiropractic, weren't turned off by it, but they went, oh, like we obviously need something different. So they turned up at the Quantum Kid and I did my neurological, postural, and cranial scan, paying particular attention to my SOT protocols and visceral involvement in particular. That's one of my passions.
Hmm.
She had some sacral stuff going on, plus what we call in SOT as a category 2, which is
Yep.
sacroiliac joint instability, some pelvic floor weakness, which was affecting her bladder position. Um, and what else? That was about it. Oh, maybe a little bit of respiratory system involvement, which I thought
Hmm.
interesting because she was also a mouth breather and
Ah.
slept terribly at night. So she
Hmm.
had come in for bedwetting and inadvertently turned up in a place where Jalal is like a breathing specialist.
Yeah.
So it was great. So they had some chiropractic. I'm assuming that the chiropractor had addressed some of the things I'd found. I didn't find anything interesting. I'm like, oh yeah,
Hmm.
this will help with bedwetting. Jalal did his assessment, recorded some dental measurements, and we both agreed that her palate was really high and narrow, which meant that her tongue couldn't sit on the roof of her mouth.
Yep.
That causes an open mouth posture and affects her cranial range of motion as well. So our treatment protocol was for me to sort out all the normal chiropractic stuff. I didn't do anything fancy really.
Hmm.
And Jalal prescribed her a mouth guard that she just wore at night. And that encouraged her to breathe through her nose and repositioned her tongue towards the roof of her mouth. It's a particular device that acts beautifully with cranial motion. It sets the bite in a position that the cranial bones move. It's kind of, I say to the mums, it's kind of like having me with my hand on your kid's head all night and making sure that you get good fluid motion. It's a really great little device. Very
Hmm.
simple. Looks like a football mouth guard. So mouth breathing is a huge
Mm.
sympathetic nervous system wind up. And so getting her to nose breathe had an enormous impact on her ability to regulate her nervous system and made my job really easy. So the dental work was making my chiropractic work easier, and the chiropractic work was making the dentist's job easier by downregulating the nervous system.
Mm.
Um, it also gave him a stable base to work from with that resilient nervous system and a flexible cranial system. So
Mm.
if my job was to balance the hips, balance the shoulders, get the head sitting straight on the neck, make sure the bones were moving really well, and get the nervous system ready for him to stick in this little mouth guard,
Hmm.
get her nose breathing, and wonderful things happen from that.
Mm.
Um, what else did we do? So the reason you need a flexible cranium is, can you imagine putting in something that's going to change the bite and it just bangs up against this really solid head?
Yeah. Mm.
That's when the cranial system's moving, you get faster and more profound work from dental work, and it's unlikely to regress back, which is really, really important for dentists.
Mm. Mm.
There's dentists who are just looking at the teeth and the bite, and then everything goes backwards when they finish their work.
Mm.
That is very bad for business for them. So this ensures that it's long-standing changes.
Mhm.
So surprise, surprise, this kid stops wetting the bed after a visit or two. But as a side effect, she's got more energy, less respiratory illnesses, and just a much more engaged kid. I think she'd probably been to a whole bunch of doctors that were doctoring her and making them do stuff. We were there having fun, involving her in the process, and she was like all over it. So neither of us alone could have had the same impact in the short period of time. I suspect, like I'm a pretty big fan of chiropractic. I think we could probably have got her there. It would have taken some time, but made each other's jobs easier and helped with symptoms that the parent didn't even know were important. So she
Yeah.
might have gone later on to get some dental work, not knowing that the breathing was really important and that the nervous system regulation was really important. But we could educate them from a really global perspective, but just actually not have to run up against the things that make our jobs difficult. Jalal absolutely could not have done his work as well without me. And if we didn't get the nose breathing under control, she was always going to have a nervous system wind up. It might have been
Yeah.
great for bank balance, turning up all the time. That's not what we're about. It's kids first, is getting
Yeah.
well in as efficient way as possible.
Yeah, look, I love that patient outcome, like we mentioned earlier too, and that's clearly a great example of that. One of the things that comes to mind is you're not treating symptoms. I
No.
think that one of the joys of listening to what you've just described there about patient X is that um, often we can get caught in the trap of chasing symptoms, which is no different to any other practitioner. But the fact that you guys look at the individual as a whole and look at the greater outcome of what can be had, not just what they presented with, like you said, with the bedwetting and the enuresis, but the breathing aspect and the
Mm.
ongoing chronic respiratory issues that the patient has been having. So that's fantastic to be able to see that collaboration brought a greater outcome to the overall health and well-being of the individual, not just the presentation of their initial symptomatology. Yeah.
Yeah, absolutely.
It's fantastic. Now, one of the things that obviously would be asked upon such a approach is timing and the
Mm.
sequence of it. Like, I mean, one of the biggest questions chiropractors have about dental collaboration is to do with timing. When do you adjust? When do you adjust before the dental work, or do you
Mm.
wait until afterwards, or who decides how that sequencing occurs, especially when it
Mm.
comes to cranial work? I know we've all done a lot of cranial work, particularly those who've done a lot of SOT, and that process takes a bit of time.
Mm.
So where does that come into play in terms of who decides what, when, timing wise?
Well, in our situation, now I don't know whether the boys just give me free rein when I'm in the room, but it kind of feels like the body people are the boss and the dentist kind of fits around that. I don't think that's the case.
Okay.
It's definitely not the case in other dental
Mm,
practices that I've
mhm,
had referrals from. And again, back to the money thing, it's like, well, I'm spending all the money here, so the dentist is the boss and you're just doing
mm,
support work. Um, I always start at the base when I'm dealing with a dental case. And so we want to make sure that the pelvis is level. There's no point getting the bite and the head level on a wonky body.
mhm,
It's the bane of dentist existence because they get the bite right. And then years later, the patient goes and gets some body work done for headaches or whatever and mucks up everything. Uh,
mm.
it's why so many people have those metal bars in their mouth after they've had
Yeah.
big orthodontic treatment because
Mhm,
the teeth will just migrate back to where they were.
mm, mm,
Possibly the spinal posture was driving a lot of the dental issues in the first place. And if they're not addressed, the dental work is destined to be less effective, if not
mhm,
fail altogether. So I'd always say do the chiropractic first
mhm,
so that they've got something to work from, a stable base and a flexible system. For the people who are not in the same room, I'd always suggest do a course of care to get things right, then go off and do the big orthodontic work. I also suggest that they swing by me if my practice is close to the dentist, have an
mhm,
adjustment on your way into getting something really big. So kids that are getting their braces adjusted, I'll say, come and have an adjustment on your way so the dentist knows this is perfect. Let's move
mhm,
your teeth to perfection rather than we're going to put it where I want it to look and then I go and muck stuff up. It'll work,
mhm,
but I think it's more efficient to get the foundation straight
mhm,
and
mhm.
give the body the best chance of accepting the changes that the dentists make.
Yeah.
Now, having said that, Jalal, there's one device that we use called an ALF, it's a light wire that sits behind the teeth, and he
Mhm.
will always get the kids to have a full osteopathic cranial after his work because it makes the device work even better. So
Oh, I
I
see.
think it's kind of horses for courses,
Hmm.
but from a chiropractic perspective, I'm thinking, why would you fit something fixed to a flexible system if it's not straight?
Hmm.
And I can't see any reason why you wouldn't do that first. Chiropractic doesn't need months and months and months of care before they can go into the orthodontics. Getting nice straight spine, straight
Hmm.
hips, that's going to be as much as you need to get them started. And then as things change, we'll just roll with the punches, so to speak.
Yeah, okay, great. So now I'm going to flip the dialogue the other way around then.
Mm,
So how do you know then, or maybe you could explain to our listeners some specific signs and symptoms
mm,
which tend to make you think when you look at the presentation that the spinal
mm,
pattern may be driven, flip it the
mm,
other way, oral dysfunction, as opposed to what you've just described. And I agree wholeheartedly with you. I've always identified, primarily the pelvis, the whole spinal
mm,
structure having
mm,
a profound effect overall. But is there a case, and if there is,
mm,
any specific signs and symptoms that our listeners need to look out for and listen to and sort of look for when the spinal pattern can be
mm,
driven by oral dysfunction?
mm. Well, there's two ways to look at this too. So
Mm,
I'm hoping that we've got a few dentists might be curious about this too, because I'd really love the dental profession to go seeking out chiropractors to make their life
yeah.
easier. So I'm biased. I can't imagine a dentist having deep, effective, or long-standing effects without addressing the systemic ramifications of the
Hmm.
jaw and bite and cranial. Um, I think there are many chiropractic cases that would have better outcomes if a dentist was involved.
Hmm.
My red flags would be jaw clicks and pops, like really obvious stuff to
Mm.
do here. Jaw and mandible tracking issues, high or narrow palates. So in SOT, we're always looking in mouths and looking at heads, but even if you're not au fait with cranial or SOT, they would be things that you want to look at.
Hmm.
Anyone with mouth breathing or sleep apnea, snoring, teeth grinding, they're all things that are looking at teethy sort of stuff. It's a no-brainer. Um,
Mm.
the other thing that would be very obvious, an asymmetrical face,
Mm.
overbites, underbites, and crossbites, all those bitey things. Parents will come in and tell you stuff, particularly
Yeah.
if you are open to collaboration and say, what's a dentist said? Any of those things where a bite isn't right and they're having to have a huge intervention in their mouth,
Mm.
chiropractic would be very useful. So you would also, if they said, I've had an opinion on this, I don't know what to do about it, any of those, I would say, at least have a dentist that can collaborate with me because I think we can help each other. Headaches, neck pains, dizziness, particularly after major dental work. That's always a red
Ah.
flag for me. I need to talk to your dentist. I need to know what they did. I need to know
Mm.
whether they're open to collaborating on adjusting some stuff whilst we have changed the way that your head sits on your neck.
Mhm, mhm.
The big thing for me at the moment in my non-quantum kid practices is women who've had braces uh, years and years and years ago, and now are finding hormonal issues that don't respond to chiropractic or naturopathic care.
Oh.
Um, that is often because the dental work has made them look beautiful,
Mhm.
but they're not functioning well. They cope, they cope, they cope. They get to kind of childbearing age and things just aren't working properly because their body is coping for a bite that's not straight or a cranial system that is compensating for stuff that's happened from making a really pretty but not functional bite.
Right, wow. I never thought about that. Years and
Mm.
years later,
Yeah.
presenting. Wow. I mean, it makes sense, right? So if your
Mm,
nervous system, and I spoke to Jalal about this, is the nature of how our nervous system is geared towards keeping us surviving. So
mm,
these poor women who are now in, that sort of later stage in life have been dealing
mm.
with chronic problems for so long. Maybe it could be, like I said to Jalal at the end of the conversation, was it may be sitting right in front of us and we haven't even addressed or looked at that yet.
Yep.
Right. So,
Mm.
wow, that's fascinating. No,
An
that's
easy
fantastic.
chiropractic case is often a difficult dental case and vice versa. Or, so anything that you find as a chiropractor, look, this should have settled down. I've done regulars. Well, maybe it's something
Mm,
that's really kind of happened in the past and they may have no symptoms whatsoever
yeah.
in that area because they're actually really resilient because of all the great
Mm,
chiropractic care. It's not
yeah.
getting a symptom because they're just it's a compensation.
Exactly. Yeah. Wow. Those who are listening right now, if you have chronic problems within
Mm,
people and you're seeing this, this is probably this is just worth everything. This is gold.
mm,
Being able to just
mm,
share that and just having them now think differently, that's
mm,
fantastic. Now, I'm going to ask you, obviously you understand chiropractic very well. So I'm assuming that there would have been some degree of learning between the two professions whilst you were collaborating, working together in
mm.
the one office. Did you
Yeah.
have to learn much about dental anatomy, appliances, their treatment approaches, and vice versa? Did they have
Mm,
to understand the chiropractic concepts and philosophy to which we do what we do, in order to make the collaboration work?
mm. Mm. I learnt most of the things I needed to know in this sphere through SOT, both here and internationally,
Mhm.
especially the work of Bob Walker, who developed chirodontics. That
Yeah.
would be my go-to for anyone wanting to kind of get into this stuff. He's a chiropractor. He works.
Yeah.
His partner's a dentist, but he had been working in the dental field well before they got together. He does great collaborative cranial work and body work. That would be a great place to start learning. Most of the knowledge I got about the appliances and the dental approach was just gained by hanging out with Jalal. I wanted to know what he did. I didn't need to
Mhm.
know about dentistry. I needed to know about Jalal Khan, dentist.
Mhm. Mhm.
And I just watched what he did and how he explained things to parents. And I suppose that was the best thing for me, rather than sitting in a room and learning a whole bunch of stuff about teeth and appliances. I only needed to know the stuff that we were using. He would agree with me that most of the stuff that he learnt was kind of a bit useless in this new field of healthcare rather than tooth care.
Mhm.
The dental team was already completely all over the cranial stuff. The chiropractic world and the osteopathic world are very, very separate. There was a conference that the whole team went to in the States, put on by the American osteopaths, where dentists could attend and chiropractors couldn't. It was really weird. I was the
Oh,
only one on the team who wasn't allowed to
wow.
attend this conference. So that osteopaths want to teach dentist stuff. Chiropractors the same. SOT often does
Yep.
inter professional stuff, and I actually think that we're the same. I don't. We're not sitting on our high horse. All those damn osteopaths. We don't teach osteopath stuff. It's very weird.
Mm.
Um, so yeah, so we're all pretty much on the same page, but
Yeah.
there are places that people can learn things. Most of the primitive reflex and vagal tone components that I brought to the cases, I'm sure the dental and maybe even the osteopathic team didn't know what I was doing. He just said to people, Beck's just going to do her magic stuff now, which is pretty funny. But it showed me what it was like to be part of a team where there was such enormous respect. We don't have to do the same things. We don't even have to really understand completely the other portion, the other people's work. We just all had to know that our approaches complemented each other, and trust that everyone was doing their bit. So a little bit of knowledge, but specific for the environment that you're in, asking excellent questions, being curious, and being on the ground to learn about the stuff that's relevant to you, not necessarily going and doing a whole bunch of specific techniques. Everyone's got
Yeah.
a technique to sell for,
Mhm.
they've got a widget for a problem. And I don't necessarily think that's a particularly good way to look at it, a little human in front of you.
Yeah, absolutely. Wow, that's fantastic. That's interesting. I never knew that they they isolated different professions from learning,
Yeah, it's
rather that
crazy.
cross-learning aspect. Maybe you're that pioneer. You're going to change all that for us, Beck.
Who
I love
thought?
it. I
If
love
anyone
it.
knew me at uni, I was not going to be the person who was doing big things in the profession. I was sitting up being naughty.
Well, your time is coming, Beck. The
Yeah.
time is here. Now, for a lot of the chiropractors listening, they would be definitely highly interested. Obviously, every community has a chiropractor and a dentist. Now, I know that the chiropractors listening on the podcast would love to know. Maybe you could give us a bit of a step-by-step advice on how to approach dental partners to work with them. What sort of skills should us as chiropractors develop in order to develop that sort of collaborative relationship? And maybe even also mistakes that they should avoid
Mm,
based on experience that you may have had, to not have people repeat that same process.
yeah. Yeah, as far as I'm concerned, it's all about meeting people and asking great questions.
Mhm.
So as a start, like tap your own patient base. Find
Yeah.
names of your patients' other practitioners and with their permission, connect with them. You don't have to
Yeah.
go and find the guy that you've never met. Find the people that are already meaningful to your people.
Yeah.
So as part of my initial consultation, I find out who my patients, naturopath, dentist, GP, psychologist, optometrist, and anyone else they see.
Mm.
And I write really beautiful, comprehensive, and collaborative reports. They are in beautiful font and they're easy to read. They're not extensive, but they're jam-packed full of really good, relevant information for that practitioner. I'm not going to tell them a
Mm.
whole bunch of stuff that I'm interested in. I tell them what they're interested in. And I let them know what I've got to add to the team. And I assume we're a team. And that seems to break down the barriers of what's perceived as maybe competition, because
Mm.
that doesn't
Mm.
help
Mm.
anyone.
No.
So yeah, my patients love that I've already just decided that we're all going to work together for their best interest. And then
It's
I'm someone
beautiful.
who's keen to bring their people together to address them holistically. So
Yeah.
once you make those great connections from your already wealth of people, the next step is to find out what these practitioners actually do. Because
Hmm.
as you know, like there's as many chiropractic techniques as there are chiropractors. The same with dentists. I sometimes meet up with them to chat and discuss a case.
Hmm.
I sometimes observe in their offices if that's appropriate. And I sometimes invite them to my office to see what I do. Now, that is really daunting, but we're really good at what we do and they've got no idea. So it's not as scary as it might seem. What
Mm.
I always, always, always do is offer them to come in and experience what I do for themselves. So having an invitation to say, can come and see this? Sometimes I do it for no fee.
Hmm.
Um, there's lots of ways to do it, but giving them the invitation to come and experience what we do, and reminding them of the people who are under their care and say to them, have you noticed that they're all getting really good response to your appliances? Have you noticed that they're all saying that they sleep better? Have you noticed that they're all nose breathing? And point it out to them so that they can attribute the great things
Yeah.
to the other people that are working on the team, not just
Hmm.
themselves.
Yeah.
As far as dental collaborations go, upskill in the cranial techniques. SOT is great for this stuff. Heaps of international conferences. If you want a lovely holiday in Fiji, there's always lovely things going on. But it's primarily about communication.
Yeah.
And if you find out from a dentist what they think makes a case really difficult,
Hmm.
and you may be able to see if chiropractic could be the piece that's missing. And never forget, we are really, really cheap comparatively. So a short course of chiropractic care could be the thing that improves their outcomes like supersonically,
Mm.
and makes them look amazing. So
Yeah.
it's a no-brainer as far as I'm concerned for them to refer to us. It's not going to be something that people are spending money with us rather than them. It's like apples and oranges.
Yeah. Yeah.
And we're going to make their job easier and make their results better by complementing their care. And I have had a couple of tricky things where I think the dentist is doing something wrong.
Hmm.
That hasn't gone well. So that's something that's mistakes I've made. Unless you know the practitioner very well and know that they are someone who's willing to collaborate and do better work, um, being able to gently suggest, this is what I've found. Maybe could you have a look at that? Is probably better than,
Mm.
hey, can you get that thing out of their mouth? That's making things worse. I
Well, there
get
you go.
excited, and yeah, if it's kids first, it's kids first. So that would
Yeah.
be the biggest thing. Just pick your audience.
Yeah, no, that's fantastic. Thank you. I appreciate it. That's great advice, and I know that this will come in very handy to a lot of practitioners. This has been incredibly inspiring and practical. This conversation, you've essentially shown us a whole new practice model,
Mm,
and I
mm,
love that. That pretty much what you're doing is you're leveraging chiropractic expertise in a
mm,
way most of us never really considered.
mm,
And I love your story. It proves that there are so many ways to practice chiropractic beyond the traditional model that we're all familiar with. I see that for me personally, and I've had the opportunity to spend a lot of time with you outside of just the work we do, and I could see that you saw an opportunity to use your SOT and that craniopathic skills that you've learned over the years in a setting where they could have maximum impact.
And that's quite
Um,
right. I didn't have to change what I do. I just had to
yeah,
find the place where what I do was really valuable. And I
yeah.
I really don't do anything fancy or different. I'm a very vanilla chiropractor, do my job very well, but
No, no.
I'm not a Malilo neurological awesome person.
Yeah.
I envy those people enormously, but I'm just doing good basic work, foundational work,
Mm.
putting it in a place where it's desperately needed. It can change the face of healthcare.
Absolutely. I think so too. I agree with you wholeheartedly about the future of chiropractic being very much a collaborative approach. Practitioners like yourself, you are showing us how to build bridges that benefit everyone, the profession, the practices that are working in silos, and most importantly, like we said earlier, the patient's need, their
Mm,
care, their outcome. This can only come from this, dropping the ego, putting ourselves, our expertise first, and then in turn working collaboratively to for a better outcome. So that's fantastic, Beck. I truly love having a chat to you about this, and I'm going to keep chatting to you more about this in due
mm,
course and find out how you're tracking with this, because I think that as a profession, we need to look at that, and we need to start using our expertise with one another in order to,
mm.
give the best outcome for our patients. Well, I got to say that I hope this conversation has sparked plenty of ideas for those who are listening. And in terms of practice evolution, this should be the next step. I think it's a wonderful thing. And if let me just remind, if everybody's listening in now, if you want to share this episode, you should do so, because this brings on collaboration. Share it with your local dentist. Talk to them about this. Let's start that process so that we can move forward together as a profession together for the better outcome of the patients.
Mm.
Beck, it's been wonderful speaking to you again, as always, and I always love having our time together. And whenever I do get a chance, we catch up on the weekends, we catch up, whether it be at seminars, and yeah, we've always got something great to talk about, and we're never short of a word between you and I.
It's never a quiet time when we're together.
Exactly, exactly. So I do appreciate everyone listening in today, and I'm going to leave sort of one lasting thing was to keep pushing the boundaries. Keep building these bridges like Beck has. Remember, our skills are more valuable and versatile than we might realize. Agree?
I couldn't agree more.
Yeah.
You're better than what the amount of money that people hand over would imply.
Yes, I couldn't agree more. Thank you so much. Beck, thank you for your time again. Thank you so much, and I look forward to catching up with you again soon enough. Well, that's it for everyone. That's it, everyone. Thanks for listening. I hope this podcast has been helpful in your quest for excellence, and I look forward to chatting with you again in our next ACA podcast. Take care and stay connected.